Antibiotics changed human history. Before them, a simple infection could kill you. But not all antibiotics work the same way. Here's every major antibiotic and how they kill bacteria. Penicillin. Penicillin was the first antibiotic ever discovered, found accidentally in 1928 from mold. How it works? It destroys the bacteria's cell wall. Without a cell wall, bacteria can't hold their shape and they burst apart. What it treats: strep throat, some pneumonia, skin infections. Side effects: allergic reactions are common. Rash, swelling, in rare cases anaphylaxis. About 10% of people report penicillin allergies, though many aren't truly allergic. Why it changed history. Before penicillin, infected wounds during World War II often meant amputation or death. Penicillin saved thousands of soldiers' lives. Amoxicillin. Amoxicillin is a modified version of penicillin, absorbed better by the body. How it works? Same mechanism. Destroys bacterial cell walls. What it treats: ear infections, sinus infections, UTIs, pneumonia. It's one of the most commonly prescribed antibiotics for children. Side effects: diarrhea, nausea, rash. Can also kill beneficial gut bacteria, sometimes causing digestive issues during treatment. Azithromycin, known as the Z-Pak, is popular because it's a short course, often just 5 days instead of 10 during 10. How it works? It stops bacteria from producing proteins they need to survive and multiply, without destroying them directly. What it treats: respiratory infections, throat infections, some STIs. Side effects: nausea, diarrhea, and in rare cases heart rhythm problems. Because of its long-lasting effect in the body, it can also disrupt gut bacteria for weeks after treatment ends. Ciprofloxacin. Ciprofloxacin is a stronger antibiotic used for more serious infections. How it works? It blocks bacteria's ability to copy their own DNA, stopping them from reproducing. What it treats: UTIs, severe bacterial infections, sometimes anthrax exposure. Side effects: this one carries a serious warning: tendon rupture, especially in the Achilles tendon. It can also cause nerve damage and is generally reserved for infections other antibiotics can't treat because of these risks. Doxycycline. Doxycycline is a versatile antibiotic used for a wide range of infections. How it works? It blocks bacteria's ability to produce proteins, stopping them from directly killing them. What it treats: acne, Lyme disease, respiratory infections, malaria prevention.
Side effects: sun sensitivity, increased risk of sunburn, can also cause stomach upset, and in rare cases, permanent tooth discoloration if taken by children under 8 or pregnant women. Vancomycin is often called the last resort antibiotic for serious infections. How it works? Similar to penicillin, it destroys bacterial cell walls, but works on bacteria that have become resistant to other antibiotics. What it treats: MRSA, antibiotic-resistant staph infections, severe hospital infections. Side effects: kidney damage with prolonged use, hearing loss in rare cases, and a reaction called red man syndrome, flushing and rash if infused too quickly. Why it matters? This is often the antibiotic doctors turn to when bacteria have become resistant to everything else. Metronidazole targets bacteria and parasites that thrive without oxygen. How it works? It damages the DNA of anaerobic bacteria, destroying their ability to function. What it treats? Certain stomach infections, bacterial vaginosis, some parasitic infections. Side effects: a metallic taste in the mouth, nausea. Importantly, alcohol must be avoided completely during treatment. Mixing the two can cause severe vomiting and a racing heart. Here's the growing problem. Bacteria are evolving faster than we can create new antibiotics. How resistance happens? Every time antibiotics are used, some bacteria survive by mutation. Those survivors multiply, passing resistance to future generations. Overuse and misuse, like not finishing a prescribed course, speeds this up. The result? Superbugs like MRSA and drug-resistant tuberculosis have emerged, bacteria that most antibiotics can no longer kill. Why it matters? The World Health Organization considers antibiotic resistance one of the biggest threats to global health, because we're running out of new antibiotics to develop faster than bacteria adapt.
Antibiotics don't all work the same way. Some destroy cell walls, some block DNA, some stop protein production. But every misuse brings us closer to a world where they stop working entirely. If you want every vaccine explained next, let me know. Subscribe.